Hello and welcome to Tenet's Clinical Integration Network CPT Category II Coding Education Training. As part of the training today, we will provide an overview of why CPT Category II codes are an important component of our providers' participation in our clinical integration or CI networks. We'll also familiarize you with the creation of our CI measures program and provide a quick summary of what CPT Category II codes are and how to use them correctly. We'll also discuss tools and ideas to implement the collection of these codes into your practices. To begin, why do we need to collect CPT Category II codes? Our CI network practices are part of an active and ongoing clinical program designed to improve the quality and efficiency of care provided to our patients. Recording and collecting CPT Category II codes assists us in tracking quality data and helps us ensure that our organization's clinical goals are being met on a consistent basis. The clinical programs that each of our CI organizations follow are designed and developed by local physician-led boards who work to create a customized group of clinical measures that is applicable for the provider's specialty areas. The measures they select are typically sourced from nationally respected entities such as CMS's Physician Quality Reporting System measures, PQRS, the National Committee for Quality Assurance, NCQA, which references HEDIS measures. Our CI organization also strive to include nationally recognized guidelines referenced by purchasers and measures that can be collected using our technology infrastructure. Our measure programs are customized by specialty so that they are applicable and meaningful to the individual practices, and the programs are typically reviewed on an annual basis and communicated to the practices. Here you'll see an example of one of our CI measure programs for internal medicine. On the left, it references the source of the measure, PQRS, HEDIS, or others. The name of the measure is included as well as a detailed description of the population the measure applies to and what is being measured for that population. Next, we wanted to touch on how we plan to collect this data. Where possible and appropriate, our CI boards have selected measures that can be collected in the hospital setting. These types of measures include patient safety measures, hospital-acquired infections, readmission rates, and joint commission measures. However, if a provider is not typically in a hospital setting, we will need to get quality information directly from participating providers' offices by way of coding your claims with CPT Category II codes. These two sources of data together will populate our clinical integration tool, which helps us establish performance tracking for our quality measures. So what are CPT Category II codes? CPT Category II codes are non-billable quality codes that facilitate the reporting of quality data in an ambulatory setting. These codes typically describe things like clinical components, radiology test results, and processes that reflect patient safety procedures. Recording these codes is important for your practice and our clinically integrated program because they help us get access to quality information that is not reported on standard billed claim. This allows us to establish a baseline for performance and identify areas for improvement. Also, since we can capture this information when it is billed, it is easier for our reliance on retrospective chart and claims review. CPT Category II codes are also required by PQRS to avoid a financial penalty and can help you better track your progress for macro purposes. When should I use CPT Category II codes? For the purposes of our CI program, you do not have to track these codes on every PQRS measure, just the ones that your CI network has chosen to track. For those patients, if the criteria for the denominator is met, then you would report the CPT Category II code for that particular measure. You will know if a patient falls in that denominator based on the demographics, such as age and gender, and if they have certain ICD-9, CPT, and HCPCS codes. The frequency of reporting is typically 12 months unless otherwise stated in the measure's definition. Also, as a reminder, you should report these measures on every patient if they meet the denominator criteria, regardless of their insurance carrier. To better illustrate how you know when to use these CPT Category II codes, here's an example using a common CI program measure: diabetes, hemoglobin, A1C poor control. The first step in tracking the measure is to identify whether or not a patient falls into the denominator population. In this case, the patient would have to fall into a particular age range, 18 to 75, at the time of the encounter, and then have the eligible ICD-9 codes reflecting a diagnosis for diabetes and your eligible CPT or HCPCS office visit codes. For example, if you have a patient that comes in your office that is 21, is recorded for an office visit, for example 99213, and the patient has a diagnosis of diabetes, ICD-9 code 250.00, then the denominator criteria would have been met and you would be triggered to record the CPT Category II code for that particular visit. Now that we have identified that the patient qualifies in the denominator for this measure, we move to the second step, the numerator, which represents the outcome of the action. The codes you'll use are called quality data codes, or QDCs, and you will use one of the provided Category II codes or temporary G codes or HCPC codes. In this example, if the patient, you would look to see that the patient's lab results and see that the most recent HbA1c levels. You would record the code that most accurately represents the patient's HbA1c, for instance 3046F if it is greater than 9, or 3044F if it is less than 7%. So how do you incorporate this kind of coding into your practice? If you're using an EMR, your system vendor will have specific instructions on how to add these codes into your system so that you can automatically record them in your system. If your office uses paper charting, you will have a super bill, patient encounter form, charge ticket, or whatever your paper mechanism is to capture these codes. You should update whichever form you use to include your applicable CI program measure and the corresponding CPT2 codes. You would then circle the numerator and denominator codes on that form. It is important to capture both on the form. If you leave out the numerator, you are not able to go back and submit a claim with only the numerator on it. This form then goes to your biller or coder that will input these codes into your claim. This is an example from the CMS website to show you a completed 1500 claim form with your Category II codes listed. In this case, the practice would have recorded an office visit 99213 in line 1 and a diagnosis of diabetes 250.00 in line 21, which you can see here, and this means that CPT Category II code should be used if the practice has diabetes CI program measures. These codes are always recorded with a charge of 1 penny. However, as mentioned before, these codes are not payable. The charge is simply recorded, so the code picked up and recorded. The penny will be reimbursed and you will need to write that off. You can record more than one CPT Category II code on a form. In this example, the form can record up to 5 measures. We also wanted to make you aware of some resources that we make available to our member practices to assist in tracking CPT Category II codes. Each of our CI networks has a detailed CPT Category II coding reference guide, which highlights the measures programs for your particular specialty and provides a variety of information, including the measure name, a description, the measure source, such as PQRS, HEDIS, or others, the abstraction settings, so you can see if this is a measure that will come out of your office or is one that we collect from facilities, and most importantly, the numerator and denominator codes for each measure so you know what codes and demographics would qualify a patient for measurement. These reference guides are available through your local ACO representatives. We recommend that you print these out and post them near your office coder as an easy reference guide to ensure that you record the right codes on your claims. We also have a short FAQ guide that covers CPT Category II coding basics. Thank you very much for participating in our Category II CPT training course, and we appreciate your continued support of our clinical integration program.